everybody. Today we're talking with Dr. Betty Jo Bradley from Livestock Vet Services in Picture Butte, Alberta. And just a little bit of background on our discussion today. A couple months ago, Alberta Milk was made aware of an outbreak of Mycoplasma bovis on a closed dairy herd in Alberta. So we wanted to get a little bit more information for our producers, mainly what is Mycoplasma bovis, what steps can you take to prevent transmission onto your farm, and what steps can you take should an outbreak occur on farm. And so that's why we have Betty Jo here with us today. So thanks for joining us, Betty Jo.
Thanks for having me.
So let's start a little bit about yourself. So what is your background and involvement in the dairy industry?
Sure. So I have been a dairy practitioner in Alberta for 15 years. I graduated from the Ontario Veterinary College in 2005 and thought I would see what the Alberta dairy industry had to offer me and my profession. So I probably fully intended to return to Ontario at some point, but Alberta grows on you. So here I am 15 years later. So I'm part of a five veterinarian dairy practice, primarily a dairy practice, about 90% dairy cattle we work on. And we also have now 2 technicians and a pretty good in-house lab and good preventative services as well. So we try to focus on preventative services. And yeah, we're happy to be here and proud to be part of the Alberta dairy industry.
Great. Well, thanks again for joining us. So a little bit more on our specific topic. Have you come across Mycoplasma bovis in your practice?
Unfortunately, yes. 10 to 15 years ago, we tended to see it more so in calf barns and also on calf raising premises. As probably a lot of the producers listening are aware, it has been quite a going concern in feedlots for a number of years as well. Unfortunately, in the last 3 to 5 years, we've seen an increasing prevalence in adult dairy cows. Sometimes we just see 1 or 2 cows in a herd with symptoms of mycoplasma, and unfortunately we have experienced also a few quite severe outbreaks. So yes, we have unfortunately had some reasonable experience with M. bovis.
Okay, so to get a little bit more into the background then, what exactly is Mycoplasma bovis?
Sure, so it's a bacterial pathogen. So it's not a virus, it's a bacteria. And it causes infection in dairy cattle. So it can be found pretty well all over the world. Countries that have done extensive testing, so perhaps some of the producers listening have heard or read about what they've done in New Zealand. So a fairly extensive government-involved testing and culling program. In the United States, it seems to be fairly prevalent too. So where studies have been done to look at prevalence and I guess the extent of presence of M. bovis across the globe, really, it can be found pretty much anywhere, it seems. Yeah.
Okay, and so what's the primary mode of transmission then for this bacteria?
Okay, so close contact between infected and healthy animals. So nasal secretions, it does also cause mastitis, so being transferred between cows during the milking procedure. Those are the main ways, but close contact of infected animals shedding to healthy herd mates.
Okay, and so when cows are infected with M. bovis, what kind of symptoms might they show?
So it can rear its ugly head in a few different ways. In adult cows, we tend to see either pneumonia or mastitis, and then also sometimes joint swellings. One of the outbreaks we had, or we were involved in, saw primarily joint infections in adult cows, and another saw primarily a kind of a combination of respiratory and mastitis. So that's kind of the main 3 ways it presents in adult cows. In calves, it tends to be more of a respiratory concern. You'll see pneumonia. You'll sometimes see a droopy ear, so an inner or middle ear infection. So you kind of get a single ear droop, and occasionally swollen joints as well. So yeah, that's kind of what it looks like for the most part.
Okay. So what kinds of farms are most at risk for M. bovis?
So farms that commonly make purchases from other farms, so it's not uncommon from kind of any other disease risk. So if you are buying animals routinely, especially if it's from mixed sources or like from mixed farms or auction mart derived, um, if you're buying, yeah, it doesn't really matter if you're buying like single animals or a group of animals, but especially if they're from multiple sources. Those are the herds that are most at risk. So I guess open herds,
Mhm.
yeah, would be the most at risk.
Okay, would that include like farms that are using bulls as well, or is it mostly just in the female animals?
No, so bulls as well, because they are obviously in quite close contact with healthy cattle. So definitely for those making even just bull purchases alone, even if it's from a single source, we have seen that crop up before. So yeah.
Okay. And then, so in this most recent case that Alberta Milk was involved in, so the producer was part of a closed herd. So
Okay.
should farms that have closed herds also be concerned about M. bovis?
Okay, I would ask a question. So closed meaning only to animal purchases. So I'm assuming that they still have potentially calf raisers coming into the farm, people traffic, that sort of thing.
Yes.
Obviously,
Yeah.
closed
Closed
just
in
meaning they
terms of
don't
animals.
actively buy animals. Yeah,
Yes. Yeah.
yeah. So sorry, what was your question about
Oh,
closed
just
herds?
so
Yeah,
closed herd should be
yeah.
concerned as well with M. bovis.
It is possible. It could show up. So I guess my other question, not knowing anything about that herd, is have they ever experienced calf barn or calf issues, right? So it is possible that you could have um, Mycoplasma bovis in your calves, and then let's say maybe a calf recovers from that, but they can actually become a carrier of M. bovis. So that heifer would then calve, become stressed, have an active infection, and then potentially spread it to other herd mates. So it could be that it was maybe lingering. I don't know the case exactly, but that's one way it could happen is it started maybe out as a calf pneumonia issue, and then yeah, an animal essentially calved and then brought it into the adult herd. Another potential way, of course, is with human traffic. So, depending on their biosecurity measures for people who have close contact with animals, right? So, veterinarians, hoof trimmers, visitors that have close contact with animals, it is possible to bring it into a barn that way, especially if you're not being strict enough with your biosecurity measures.
Okay. So talking a little bit about prevention then,
Mhm.
what can producers do to risk or to reduce the risk of getting M. bovis on their farms?
So just the things I think everybody by now has probably done a biosecurity risk assessment with their herd
Mhm.
veterinarian. So probably taking a good look at that and being honest with yourself and say, having a discussion with your herd vet and saying where are our bottlenecks and where could a potential breach occur. Um, so yeah, I think it's great that everyone by now has had a chance to go through a biosecurity risk assessment and has had an opportunity to kind of have an advisor go through that with them and look at where the potential breach points are.
Okay, in your
Yeah.
experience, like what would be a couple of like just to pull out one or two examples from that biosecurity risk assessment, what might a couple really important or key things be for producers to look at for biosecurity?
Okay, so we're talking about open and closed herds.
Yes,
Both.
yeah.
Okay. Yeah. So back to the high. So the highest risk again is making animal purchases. So with single animals, for example, with a bull, I think the biggest thing is because it seems like sometimes I guess a single animal or a group of animals arrives at the farm. So in the case of adult cows, if you're purchasing a set of milk cows, it's very difficult to segregate or isolate them from other herd mates, at least as far as nose to nose contact goes. So if that is at all possible, I think that's great. So having basically a 2-week monitoring segregation or isolation system so that if the animal does become sick, um, you're aware of that. You can test them. They're not mixed in with the whole herd. Even better is to be able to do some sort of testing, or at least ask questions of the herd of origin, right? So yeah, there are screening tests you can do for Mycoplasma, but even asking questions about, have they seen pneumonia in adult cows, or have they done any M4 tests to look for Mycoplasma? Just asking questions, and then doing some testing, preferably before animals get to the farm, but most certainly in that 2-week period of segregation and health monitoring, and then going from there. So that would
Okay,
be
and
two
then
biggies.
for more of the closed herds, is there a big point of biosecurity that they should be focusing on?
So again, like back to the coming from the calf barn to the adult cow herd, or vice versa, could go the other way. So having good biosecurity protocols for young stock versus adult stock. So that's a good thing to be mindful of. So working with youngest animals first, or if you have to go from, say, handling sick animals, making sure that you're changing coveralls, disinfecting boots before you handle any healthy animals. For closed herds, aside from that, definitely making sure that you have either farm-provided clothing for farm visitors who are in close contact with animals, or having certainty that, say, your veterinarian, for example, is showing up with thoroughly disinfected boots, clean coveralls, clean splashers. Yeah, just making sure, especially the people that are in close contact with your animals, are following your biosecurity protocols.
Okay. And you also mentioned that it can present as a mastitis as well. So is there any recommendations around the milking time that would help to reduce spread?
Yeah, so going back to, if you do introduce a new group of animals, certainly milking them last, at least for 2 weeks, or until you can, say, have an M4 test to confirm they are Mycoplasma negative, for example. It is a contagious mastitis, so the control measures or best management practices that control other types of contagious mastitis are applicable here as well. So wearing gloves, using single-service towels, and an effective post-it program in particular are kind of the best control measures for contagious mastitis.
Okay. And then you also mentioned, so there is testing available for individual animals coming into the farm. Is there testing that producers should be looking at for their entire farm in general?
Yeah, so one thing, I guess if you are concerned about an individual animal, so let's say you have a cow that has a recurring like tough to treat mastitis, or she's had a respiratory event with a tough to treat mastitis, or swollen joints. So remember, those things can happen independently or all together. You could test that individual animal. So one easy way if producers are on DHI is through the M4 test. Also, your veterinarian can do a deep nasal swab if you have an animal with pneumonia. Those are two good ways for testing on live animals. Of course, if you happen to have an animal that dies, we can use postmortem tissues and send those away for testing. On a herd level, we can do bulk tank screening. That's probably the
Okay.
best way on a group level.
So even if on farm there aren't any cows presenting with M. bovis, do you recommend any sort of like routine bulk tank sampling that producers should use for M. bovis and other pathogens as well?
Yeah, so relating to M. bovis specifically, I probably would have said not necessarily up until the last few years, but it does seem to be increasing in prevalence in Alberta, is what we've noticed. So I do think it's a good idea to screen your bulk tank even every other month. It's a great time to screen your bulk tank for other contagious mastitis pathogens as well. So I think it's a good thing to get into the routine of, and that way it also acts as an early warning signal. If you do happen to have never seen Mycoplasma and suddenly you get a positive bulk tank, you're actually able to intervene in a more timely manner and kind of avoid disaster
Yeah.
in some cases. So, yeah.
Okay. So I guess getting a little bit more into what happens if it shows up on your farm. So if an outbreak occurs or you get that positive bulk tank sample, what should the first steps be that a producer will take?
So most producers will be screening through the veterinarian if you're talking about a bulk tank sample, but get in touch with your herd vet. unless they're the ones letting you know that you're positive, and work with them to screen cows. So you would go to individual testing or even string sampling groups of cows, depending on the size of your herd. So if you have a smaller herd, you could probably do some more individual testing. If you have a larger herd, you can actually string sample cows. So what that means is testing larger groups of cows together to kind of identify where the positives are, and then going back and doing individual testing. But you definitely need to work towards finding, segregating, and unfortunately culling your positive cows. And the sooner you can do that, the less, the better it is as far as spreading through your herd and causing more of a disaster situation.
Okay, so are there any treatments out there that producers can use for this?
So there's very few antibiotics we have in general that are effective against Bovis, and we certainly do not have any lactating cow antibiotics approved for lactating dairy cows that are effective at all. So unfortunately, it really goes back to early detection, prevention, segregation, and culling.
And so let's say you notice something like this mastitis in your cows first. Should you also be testing your calves and young stock right away, or just assuming it's staying in one spot?
It depends on, I guess, the herd history. So if you're noticing that you've also recently had sick calves, that definitely warrants some testing in the calf barn as well. So we have seen it in our practice go primarily in the closed herds, in particular, from calves to cows. It could also go from cows to calves. So especially if you're feeding, say, unpasteurized colostrum or milk, it certainly can affect other groups of animals in your farm. So yeah, you'll want to look at the whole picture and see if testing is warranted.
Okay, so what can be done? Can you eradicate M. bovis from a farm once it's there? What steps can kind of be taken to get it off the farm, or to, I guess, manage it if you can't eradicate it?
Yeah. So again, with personal experience, we have seen M. bovis, or I'm thinking of one herd in particular, that basically only saw respiratory disease in lactating cows. We've never found it in calves. We never saw it present as mastitis or swollen joints. So what we did was we deep nasal swabbed animals that had a clinical case of pneumonia within the last month, basically. We found only 3 cows that were clinically ill that tested positive. Fortunately, they were able to, or I guess made the decision based on my advice, to actually take them off the yard. So take them totally away out of the herd. And we have been screening that herd, and fortunately, we haven't had any positive bulk tanks since then. So I guess you can never really say it's eradicated. You certainly want to keep tabs on and utilize diagnostic testing to kind of monitor it. So I think you certainly can get it very under control if you're willing to segregate and cull affected animals that have tested positive. And then just with very vigilant preventative monitoring, I think it is definitely controllable.
Okay, and then so kind of what I'm hearing is that it's really a farm by farm basis, like it presents in different ways and it might, be managed in different ways based on the farm.
That's very true. Yeah. Again, like most farms, we get some positives. It kind of trickles through if the farmer is willing to aggressively and early in the disease course or the outbreak aggressively manage that. It does seem to kind of fizzle out, and then we'll just monitor the herd situation by bulk tank monitoring. Unfortunately, in the really bad outbreak scenarios, it obviously becomes more difficult to manage, and you've got a larger number of cows you're looking at culling. So I guess quite severe outbreaks in. The one herd, for example, had to overcrowd their cows for a period of time in warmer weather because they were building a new barn. So it does seem as though that the more severe outbreaks that we've had experience with, there seems to be some sort of herd stress factor that seems to make it more aggressive, if you will. Okay. Yeah.
So any kind of stress like that could be, so based on housing or calving or?
Yeah. So if there's any
situation?
any situation, especially if it affects like a large number of animals. So like a crowded hospital pen, a crowded fresh pen, you're just crowding cows because you're doing a reno. I mean, some of those things are unavoidable. I recognize at certain times, but some of the worst outbreaks we've seen have stemmed from an event like that.
Okay.
Yeah.
And then, so it sounds like the earlier you catch it, the better. So the bulk testing and preventative measures are important in that sense.
Definitely. And like make sure you're spending your money on testing and not trying to overtreat something. So you definitely don't want to ignore the problem and let it really go through the herd. So you want to work with your herd vet and be as proactive as you can and put some dollars on testing, as opposed to kind of waiting and seeing, or say having untreatable mastitis and adult cow pneumonia for months and months and then, never addressing it. That's when things can get a little out of hand. Yeah.
Okay, well, I think that was kind of it for all of the questions I had. Is there something we didn't cover that you wanted to bring up?
No, I think you guys had wanted to ask me, I guess, any take-home messages or what I might want producers to kind of here. So yeah, I guess just to summarize, be vigilant. Mycoplasma bovis is definitely out there. Our practice looks after about 10,000 dairy cows, and we have seen more herds affected in the last few years. So be vigilant. Don't panic too much, but be vigilant. Maybe do some bulk tank screening. Talk to your herd vet about your risk level, and the other thing is don't worry about being too grouchy about biosecurity. I know sometimes it's neighborly to have your friends over and have a tour through the barn, but I think it's pretty standard to ask people to put on booties, things like that. So don't worry about being too grouchy about biosecurity. And certainly don't ignore the problem. If you have cows showing any of those symptoms, make sure you're doing diagnostic testing and keeping tabs on it. So.
Okay, well, thank you very much for taking the time today. I think that's a lot of really helpful information for our producers.
You're most welcome. Thanks for having me.
No problem.